This question about reflux for newborn infant, pretty much I would say 90% of my patients that come in with newborn will have issues with reflux. And question about reflux, in general, my experience is that around the 2 weeks, 4 weeks mark, parents are starting to ask and point out symptom of reflux, the spit up and the fussiness and such. And then normally by 4 months is when they really struggle and they really need to get some option in terms of the treatment on board. But basically, my approach to reflux, I tell parents is that our baby is going to be refluxing somewhat. They're going to have some reflux coming up, whether it's come up to their esophagus here, and you may not see it coming out. Doesn't mean it's not there.
Mm-hmm.
Some may come out to the throat, some may come out the mouth, some may come out the nose, some may come across on your shoulder, some may come across the room like exorcist, and so it just vary in terms of degree. So all baby in general tend to reflux. The question is that when it become a disorder, when it become what we consider gastroesophageal reflux disorder, that for me, I kind of basically break it down, simplify it to the parents, is that when your child spit up to the point where they are starting to lose calories and they're not able to gain weight appropriately, then that's a concern. When they start to come up, instead of coming up and out, which is more messy and inconvenient, but it starts coming up and they come back down the wrong pipe and they start choking, gagging, aspirating, turn blue. That's a concern. That's your concern for complication that comes with aspiration. So that's something you have to jump on board to help them out in prevention of that. Third concern is that anytime you're refluxing, some of the acid content come up with it. And when it does that, it can cause these irritations to the lining of the esophagus. And that over a long period of time not only causes the child to be very uncomfortable, very fussy, very cranky, but also can cause irritation, inflammation to the lining of the esophagus, leading to chronic inflammation, chronic ulcers. And so that's something that we do want to make sure we treat and prevent. So one distinction I try to get parents is that, stepwise, first and foremost, most baby in general, you do want to encourage them not to overfeed. Too much goes in, they'll come back up. Generally encourage them to do frequent burping in between and at the end of the feeding to alleviate the excessive gas in there. We also try to encourage after feeding to keep them upright, 30 to 45 degrees upright, to kind of for a period of time, 30 minutes or so, 45 minutes after feeding, so that way generally to kind of keep the stomach content in the stomach a little bit longer before it come back up. Try not to jostle them around too much, put too much pressure against the abdominal area. That may also encourage the reflux. And there are options out there in terms of thickening up the feed, whether it's simply thick or whether it's rice cereal that we can put in the formula or breast milk that may make it a little bit more easier for this to stay in the stomach instead of coming back to the esophagus. So those are options that conservative measure that we can use. There are wedges out there that we can recommend that you can let your child sleep on an inclined position a little bit, so that way the reflux doesn't come up as much. So those are simple step strategy that you can help them. Now, once the child starts to develop the disorder aspect, whether it's the irritation from the acid and such, there are options, pharmaceutical option out there, medicine that we can decrease the acid content. And basically what that does is just make a cranky spitter to a happy spitter, basically. It's really decrease that acid content so it doesn't irritate the lining of the esophagus, decrease the pain, the symptom, but also decrease the risk of ulcers that can be very severe. And also long-term wise too, it also helps prevent what we call silent aspiration, where the child may not be symptomatic, but at night they can have some of this tiny aspiration from the gastric content into the lung. That may lead, studies have shown that it has a high risk of developing asthmatics down the road. So these are child that you have to recognize and you have to be aggressive in preventing to get to that point. There's also further more severe cases where despite those maneuvers they continue reflux, and they definitely need the help of specialists like GI, where they need to consider doing further testing, not only confirms reflux in the esophagus but also see the severity of damages done and whether they have to recommend further aggressive procedures such as the Nissen fundiplication procedure, which is a gastric procedure to help prevent reflux. So there are different stages that you have to recognize where your child's at. But in terms of treating reflux, it's first and foremost recognizing it's there. and